So one of the treacherous things about radon exposure is that there's not any real symptoms that come from that. It's colorless, odorless gas, comes up from the soil. It's in the air everywhere, but it's concentrated in certain areas, such as in the home. In today's homes that are pretty well insulated and, for efficiency, we've isolated that air flow. It's not something that comes across as evident as tobacco smoke. You always know that that's in the home. You may not be aware of how much is retained in your home even after cessation of smoking, but when it comes to radon, you don't know that it's there at all. However, radon is the second leading cause of lung cancer in our country, and so we have to worry that that's a health effect that is unappreciated by most practitioners. Unfortunately, it's not tested for frequently enough. Many people don't know that their homes can even be tested. They don't know that their homes should be tested. So we wind up with patients that may be living in high levels of radon unaware and continuing that exposure even though there's a effective mitigation to be able to reduce those levels in the home and decrease their risk of lung cancer, even in non-smokers. Radon in high levels is inhaled, and it's actually a particulate substance that has a constant emitter of radioactivity. And so when that's inhaled, it winds up delivering itself down to the levels of the bronchi, into the alveoli, and it sticks, and it winds up with constant emission of that radioactivity, which causes DNA damage. And it's that DNA damage that ultimately leads to carcinogenesis, leads to the development of cancer in those cells, and then ultimately will grow into a tumor and potentially will metastasize. With additional tobacco exposure, for example, we may have more damage to the DNA and more carcinogenesis that occurs. If we add to that the DNA damage that occurs from the radioactivity exposure from the radon gas, then we now have a double hit phenomenon. We have the damage from the tobacco, and we have the damage from the radioactivity of the radon gas that ultimately can lead to cancer at higher rates. The data that we have for lung cancer and radon came from high levels, or came from exposure typically seen in those that were working in the uranium mines, and ultimately from some Canadian data as well that looked at high levels of radon in the home and correlated that with increased risk of lung cancer. I think that the important thing is that if there's anything that we can do to reduce the risk of lung cancer, we should be tackling that, especially in Kentucky. We carry such a burden of this disease, and we have a high incidence of this disease. We should be reducing smoking exposure. We should be reducing anything that causes lung cancer, and if radon's one of those that has that influence, then we should be testing for that and making sure that patients are mitigating their homes as safely as possible.